This combination of 3 medications is used to treat heartburn and other symptoms caused by too much acid in the stomach, acid indigestion. Famotidine is a drug that blocks acid release in the stomach and can help stop heartburn and acid indigestion from coming back. Calcium carbonate and magnesium hydroxide are antacids that work quickly to lower acid in the stomach and stop heartburn. This medication is beneficial for treating heartburn and other symptoms caused by excessive stomach acid. It works by blocking acid release in the stomach and quickly lowering acid levels to provide relief. The recommended dosage is typically taken as needed, usually 1 to 2 tablets chewed thoroughly before meals or as directed by your doctor. It is best to take this medication at the onset of symptoms for maximum effectiveness. When using acid Reducer-Antacid 10 mg, 800 mg, 165 mg chewable tablet peptic ulcer agents, it is important to chew 1 tablet completely and swallow as needed to stop/prevent the symptoms of heartburn and indigestion, or as directed by your doctor. It's important not to swallow the tablets whole. Do not take more than 2 tablets within 24 hours and make sure to follow all directions on the product package. If you have any questions, be sure to ask your doctor or pharmacist. This product contains an antacid which may react with other medications, preventing them from being fully absorbed by your body. It's important to talk with your doctor or pharmacist about how to schedule your medications to prevent this problem. If you find that your symptoms continue after you begin taking this medication, or if they do not improve after you have been taking this medication for 14 days in a row, it's important to stop taking this medication and call your doctor promptly. Do not take this medicine for more than 14 days in a row without talking with your doctor. Some common side effects of acid Reducer-Antacid may include diarrhea, headache, constipation, or stomach cramps. If these effects persist or worsen, it is important to consult your doctor or pharmacist. Your doctor has prescribed this medication because they have determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. However, it is important to seek medical help if you experience any serious side effects, such as easy bruising/bleeding, signs of infection, or mental/mood changes. Additionally, seek immediate medical help for very serious side effects, including irregular heartbeat, severe dizziness, fainting, or seizure. While a severe allergic reaction to this drug is rare, it is crucial to seek medical help if you notice any symptoms of a serious allergic reaction, such as rash, swelling, or trouble breathing. It is important to note that this is not a complete list of possible side effects, and any other effects should be reported to your doctor or pharmacist. If you are in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before taking this product, make sure to inform your doctor or pharmacist about any allergies you may have to famotidine, other H2 blockers, or antacids containing calcium/magnesium. This product may contain inactive ingredients that can cause allergic reactions or other problems. If you have kidney problems, liver problems, or other stomach problems, it's important to consult your doctor or pharmacist before using this product. Some symptoms you may be experiencing could actually be signs of a more serious condition, so seek medical help right away if you have certain symptoms such as heartburn with lightheadedness/sweating/dizziness, chest/jaw/arm/shoulder pain, unexplained weight loss, trouble/pain swallowing food, bloody vomit, or bloody/black stools. It's important to note that this medication should not be used in children younger than 12 unless directed by a doctor. Older adults may be more sensitive to the side effects of this drug, especially mental/mood changes, seizures, or unusual tiredness. During pregnancy, this medication should only be used when clearly needed, so make sure to discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions with acid Reducer-Antacid 10 mg, 800 mg, 165 mg chewable tablet peptic ulcer agents. Certain medications may not work as effectively or could lead to serious side effects when taken together. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include bisphosphonates, tetracycline antibiotics, quinolone antibiotics, calcium channel blockers, digoxin, and thyroid medicine. It's also important to note that some products need stomach acid to be properly absorbed by the body, and the decrease in stomach acid caused by famotidine may affect how well these products work. This includes medications such as atazanavir, certain antifungals, and thyroid medicine. Additionally, it's crucial not to take this medication with other products that contain famotidine or other H2 blockers like cimetidine, nizatidine, or ranitidine. Be sure to consult with your doctor or pharmacist if you have any concerns about potential drug interactions. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. If you're taking acid Reducer-Antacid 10 mg, 800 mg, 165 mg chewable tablet peptic ulcer agents, it's important to consider making some lifestyle changes to help the medication work better. This includes stress reduction programs, quitting smoking, limiting alcohol intake, and making changes to your diet by avoiding caffeine and certain spices. It's best to talk to your doctor or pharmacist about any lifestyle changes that might benefit you. When it comes to treating peptic ulcers, acid Reducer-Antacid chewable tablets can be a helpful option. These tablets work by reducing the amount of acid produced in the stomach, which can help alleviate symptoms and promote healing. The recommended daily dosage for adults is 2 to 4 tablets, taken either 1 hour before or 1 to 3 hours after meals and at bedtime. It's important to follow the dosage instructions provided by your healthcare provider. Taking these tablets at the optimal timing can help maximize their effectiveness in managing peptic ulcers. It's important to store this medication at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When you no longer need this medication or it's expired, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. Remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.